So I'm still getting some topics for conversation from the Something Goes Wrong podcast, season 23. And in episode 1, Kristen talks about how at 30 to 32 weeks, she had a significant vaginal bleeding episode. She called the EMS because she was just leaving work, and they took her to the hospital that the birth center where she was getting prenatal care with midwives was affiliated with. They watched her overnight. She had no more bleeding, and when she asked if this was a placental abruption, because she had heard about placental abruption before, they said that it probably was, but they didn't know because they didn't see anything on ultrasound. And the next day she was sent home. A couple days later, she goes back to work and she starts feeling period cramping. No bleeding, period cramping. She calls the birth center midwives line, and the midwife that was seeing her and taking care of her, who was actually a student, by the way, and not a midwife, but that's neither here nor there, asked to see her. Kristen goes in to see the midwife, and the midwife says she thinks it's a subchorionic hemorrhage and gives her a supplement called eutrophin. And she says that this supplement, eutrophin, calms the agitated uterus. So let's talk about eutrophin. Now, eutrophin is a supplement that is supposed to support uterine health. And its main ingredient is bovine uterus extract. So this is what eutrophin is supposed to do for the uterus. Pause to read. So besides that just being complete and utter BS that's not proven, there is no evidence or data, safety, anything on its use in pregnancy. Nada. Huge red flag that a healthcare professional, even if it was a student, would tell a pregnant individual who had just had a significant bleed to take that. Now, the next thing I want to talk about is the difference between a subchorionic hemorrhage or hematoma versus a placental abruption. Now, this is the amniotic sac. There are 2 layers of the amniotic sac. The first layer is the amnion, the second layer is the chorion. The chorion is closest to the uterine wall. And you can get a bleed between the chorion and the uterine wall in the form of a subchorionic hematoma or hemorrhage. Now, subchorionic hematomas are actually very common on first trimester ultrasounds. We see them a lot. They can be small, they can be big. And a lot of times the patient is completely asymptomatic, meaning no bleeding whatsoever. And then other times they may have some bleeding. Now, whereas a subchorionic hematoma or hemorrhage typically occurs before 20 weeks of pregnancy, especially in the first trimester, a placental abruption occurs after 20 weeks of pregnancy, and it can be associated with a subchorionic hematoma that has not resolved. Now, a placental abruption can occur right behind the placenta. It can occur in the same place as a subchorionic hematoma between the uterine wall and the chorion. And it can occur pre-placental, meaning on the surface of the placenta in the membranes before you get to the amniotic fluid. So those are the 3 most common locations of a placental abruption. Now, you can't always see evidence of a placental abruption on ultrasound. If a patient comes in with acute vaginal bleeding for no other reason, it's likely from a placental abruption. And you can't tell how big it is, and you can't always tell where it came from in the uterus. But a placental abruption can lead to these potential maternal and fetal consequences. Pause to read. So, at 30 to 32 weeks, this was not a subchorionic hematoma or hemorrhage. This was a placental abruption.